Hello everyone. I have already covered the up to head to toe examination in newborn. Today I will tell you the details of gestation age estimation. There are basically various scoring systems by which we can calculate the gestation age of the newborn. Modified Ballard and new Ballard scores we are using in our NICU and in most of the places. There are some other scores, example revised Dubowitz score, in which also neurological and physical criteria are there, but it is in more detail and compared to the new Ballard. In new Ballard, there are 12 criteria, while in the revised Dubowitz, there are 22 criteria. In Parkin, Bhagwat and CBSC scores, there are only physical criteria color, breast, bud, and sole creases, ear cartilage. So it is comparatively less accurate than the new Ballard score, and it also not considering any neurological or neuromuscular score. Other are Ergi and Capro. I am going to tell you the details of modified Ballard or new Ballard scores which we are using and also ask in the exams. In New Ballard scores, there are physical and neuromuscular criteria. Both are having the 6 parameters. Each criterion is given the score between -1 to 5, minimum scoring -10 and maximum 50. And we can estimate the gestation age between 20 weeks to the 44 weeks by this method. So it is also very helpful for the extremely premature babies because we can estimate the gestation age even of 20 weeks baby. In neuromuscular criteria, we have to see the posture of the baby, then we should examine for the arm recoil, square window, scarf sign, popliteal angle, heel to ear maneuver. In physical criteria, see the skin color, texture, lanugo hair, eyes, ears, genitalia, plantar surface for the sole creases and breast bud. These are the images of neuromuscular criteria: posture, arm recoil, square window test, scarf sign, popliteal angle, and heel to ear maneuver. So in the neuromuscular criteria, first we should see the posture of the baby. Here in this video and image you can see the baby is having the flex posture of all four extremities. And for posture, there are scores between 0 to 4. 0 we label when there is a complete extension of all four extremities. 1 when there is a slight flexion as the baby mature. Then 2 scores when there is a semi-flexion of all four extremities. 3 scores when there are complete flexion of lower extremities and slight flexion of upper extremities. And in full term baby, there is a complete flexion of all four extremities. So for this baby, scores are for posture 4. As the baby mature in cordocephalic direction, this muscle tone increases and flex posture baby can maintain. Basically by the posture we are assessing the passive tone of the baby. Now in the arm recoil you can see in this video that we have to extend slightly the arm for a fraction of seconds, then we have to release, and after that we have to check the angle between arm and forearm, and according to this angle we can assess the passive flexure tone of the bicep muscle. So here if this angle 180 degree 0, which is seen in extremely premature baby, if 140 to 180 1, 110 to 140 2, and 90 to 110 3, and less than 94. So here the angle between arm and forearm in this baby less than 90 degree. So again score for the arm recoil 4 in this baby. Now third is the square window test. We have to gently press the dorsum of hand and we have to see the wrist flexion angle, and this angle is decreased as the baby matures. So in the extremely premature baby, this angle is more than 90°, while in the full term baby this angle is 0. So in this baby, when you will see this angle is almost 0. So score for the square window in this baby 4. So -1 when it is more than 90 degrees, 0 when it is 90, 1 when it is 60, 2, 45 and 3, 30. So in this child score is 4 because this angle is 0 for the square window. In video you can see how to perform the scarf sign. We have to pull the arm across the chest just like we are tying the scarf. And we have to see the position of elbow in relation to the body landmark at the chest. And by this method, we are assessing the passive tone of flexor muscle of the shoulder girdle. So scores we are giving -1 when elbow is crossing the contralateral side of axillary line. 0 score when elbow is just touching the contralateral side of the axillary line. 1 score when it is crossing the midline and touching the contralateral nipple line. 2 score when it is just touching the midline at Jeffoid process as in this child. So we will give the 2 score for this baby for the scarf sign. 3 score when it is not crossing the midline, just touching the ipsilateral nipple line. And 4 when it is not even able to cross the ipsilateral axillary line. So as the baby will mature, resistance will increase, flexibility will be less, so elbow will not be able to cross the beyond these landmarks. So scores for the scarf sign in this baby 2. Now in the popliteal angle, you can see in this video that we have to flex the hip, and after that we have to gently extend the knee joint, and we have to see the angle at the popliteal fossa. So in this image you can see this is the popliteal angle of this baby, and we have to give the score -1 when you are able to extend even up to angle 180°, 0 when up to 160°, 1 when 140°, and 2 when 120°, 3 when 100°, and 90°, then 4 score. When less than 90°, then 5 score as in this child. You can see this is less than 90° angle. So score for the popliteal angle in this baby 5. In heel to ear test, we have to pull the foot toward the ipsilateral side of ear, and we have to see the distance between the heel and ear and position of heel in relation to various body landmarks. By this method, we can assess the passive tone of posterior pelvic girdle flexor muscles. So we have to give the score between -1 to 4 when heel is touching the ear. In extremely premature baby, we have to give the -1 score. 0 score when heel is not touching the ear but it is near to the ear or at the nose level. We give the 0 score as in this child. You can see scores are 0 because it is heel is just near to the ipsilateral side of ear and at the level of nose. When heel is at the level of chin, we give the 1 score. 2 score when heel is at the level of nipple. 3 when heel is at the level of umbilicus, and 4 when heel is at the level of femoral creases. So except in -1 score, in all the 0 to 4, heel will not touch the ear, and we have to see the position of heel in relation to the body landmark and distance between the heel and ear. We have to give the scores. So for heel to ear in this baby, scores are 0. So total neuromuscular scores for this baby are: for posture, we had given the 4 score, for arm recoil also 4 score, for square window 4, for scarf sign 2 score, for popliteal angle 5 score, and for heel to ear 0 score. So total neuromuscular scores are 19. Now in the physical criteria, we have to see the skin color and texture. We have to see the lanugo hair, then see the eyes and ear, then breast bud, then plantar surface and genitals. So now I will tell you the details of all the physical criteria. In physical maturity, first we have to see the skin color and texture. In this video, you can see the color of skin is pink and baby is having the smooth texture. So we have to give the score between -1 to 5. As the baby will mature, scores will be increase. In extremely premature babies, skin is sticky, friable, transparent. Scores -1, 0 when it is gelatinous, red, translucent. 1 score when it is smooth, pink and some visible vein. In this child, skin is smooth and pink. So for skin, score is 1. 2 when there is a superficial peeling, rash, visible vein as in the late term baby around 39 to 41 weeks. 3 score when there is a cracking, pale area, really veins are visible. 4 when there is a parchment, deep cracking, no vessels in postpartum baby. And leathery, cracked, wrinkled skin, we give the 5 score for this. So for this baby, score is 1 for the skin physical maturity. After skin, we have to see the lanugo hair, thin, fine and light color hair present over the shoulder and back. You can see in this baby, and some bald area also present. Lanugo hair are abundant around 28 weeks of gestation age. It start to appear around 24 weeks, and in babies less than 24 weeks of gestation age, no lanugo hair will be visible. So -1 score. Sparse between 24 to 28 weeks, 0 score. Abundant around 28 weeks, 1 score. Then thinning start. So 2 score. When bald area also visible between the lanugo hair, then 3 score. So for this baby, we give the 3 score because lanugo hair also visible and some bald area in between also visible. Mostly bald area when the baby is late full term, then 4 score. So for lanugo in this baby, score is 3. Then we have to check the eyes and ears. In ears, we have to fold the ear, then we have to release it, and we have to see the recoil of the ear. If baby is full term, because cartilage is well formed, then this recoil is instant. And this curvature of the pinna should also be checked. As the cartilage will be formed, then this will be well curved pinna and eyes are open in the full term baby. We have to give the -1 to 4 score. In -1, eyelids are fused loosely, -1, and tightly fused in extremely premature baby. You will not be able to open the both the eyelids apart, and we give the score -2. 0 score when lids are open but pinna is flat, and when you will fold it, it remain folded. No recoil will be there. Then 0 score. 1 when slightly curved pinna, soft pinna and slow recoil is there. Then 1 score. 2 when well curved pinna but soft and ready recoil. 3 when formed and firm pinna, as you can see in this baby also, and instant recoil. So for this baby score is 3. And 4 when thick cartilage, ear is stiff, then we give the 4 for late term and post term baby. After that, we have to see the areola and breastbud, and we have to palpate the breastbud between thumb and finger, as you can see in this video. and we have to give the score between -1 to 4. -1 when imperceptible areola is there, no breast bud. 0 when barely perceptible areola. 1 when flat areola, no bud. And 2 score when stippled areola and 1 to 2 mm size of bud is there. And 3 score when raised areola and 3 to 4 mm breast bud. And 4 when full areola, as you can see in this baby also, and 5 to 10 mm size of breast bud. So for breast bud and areola, score for this baby 4. Then we should check the plantar surface for the sole creases, and also we should take the length between the great toe and heel. So we have to give the score between -1 to 4. When there is a no creases in extremely premature babies and heel to toe length between 40 to 50 mm, -1 score. When less than 40 mm heel to toe length, -2 score. 0 when more than 50 mm length and no creases over the plantar surface. 1 when hardly faint red marks are there but no deep creases are there, then 1 score. 2 score when anterior 1/3 of the sole is having the major and large deep creases, we give the 2 score. 3 score when anterior 2/3 is covered with the deep creases. As in this baby also you can see the deep creases are present over the anterior 2/3 part. So we will give the 3 score for the plantar surface. 4 score when creases are present over the entire sole in full term and post term baby. After that we should check the genitals and we have to give the score. And for male baby, according to the descent of the testes and rugosity over the scrotum, we have to give the score between -1 to 4. If scrotum is flat and smooth, we give the -1 score. If scrotum empty and faint ruggy are there, 0 score. Testis in upper canal and rear ruggy, 1 score. Testis descending and few ruggy, 2 score. Testis down and good ruggy, then 3. And testis pendulous and deep ruggy, then 4 score. In female baby, when clitoris prominent and labia flat, -1 score. When clitoris prominent and small labia minora, 0 score. Clitoris prominent and enlarging minora, 1 score. When majora and minora equally prominent, then 2 score. When majora large and minora small, as in this baby, then 3 scores. So for this baby in genitals, we will give the 3 scores. When majora cover the clitoris and minora, we give the 4 score in late full term and post term baby. So for physical scores in skin, baby is having the 1 score. For lanugo hair, 3 score. For eyes and ear, 3 score. For breast bud and areola, 4. For plantar surface, 3 score. And for genitals, 3 scores. So total physical scores are 17. So total Ballard score in this baby, physical 17 plus neuromuscular 19, so total 36. So these are the scores and this is gestation age in weeks. So baby is having 36 score, so around 35, so gestation age 38. So we have to mention 38 plus minus 2 weeks gestation age because variation of plus minus 2 weeks occur with the new Ballard scoring system. Reliability of new Ballard scoring system depends on the gestation age of the baby and when you are performing. So if age of the baby is less than 26 weeks, if you perform before 12 hours, then it is most reliable. In more than 26 weeks, if you are performing before 24 hours of birth, then it is most reliable. Otherwise, it is valid up to 7 days of postnatal age. But its validity will decrease, significantly decrease after 7 days of postnatal age. And we can also calculate by the formula Gestation age in weeks equal to 2 multiply the score plus 120 divided by 5. And here you can see when a score between minus 10 to 50, these are the weeks. So minus 10, then 20 score, and similarly when 50 score, then 44 is the gestation age. I have already uploaded a video on new Ballard scoring system on this YouTube channel. You can go through it also. Thank you so much. This is all about gestation age estimation in newborn.